Good morning, everybody, and welcome to our professional day for the Medicine and Surgery degree course. I hope that you can all hear me, and for the moment, I kindly ask you to switch off your microphone in order to avoid any possible noise. I introduce myself. My name is Elisa Commentale, and I work for the Orientation Office here in Humanitas University. Of course, we would have preferred to host the professional day here at our campus, and hopefully we will be able to do it again. But at the moment, all the staff, professors, students of the university, we all think that is our big responsibility to comply the government's instructions. For this reason, we are trying to guarantee all the orientation activities online as it is happening today. So, before starting with the main activities of the day, together with Professor Maria Rescigno and Professor Riccardo Sarti, and then with Dr. Fabio Carfagna, I would like to tell you more about who we are. So about Humanitas Group and Humanitas University. And I will start talking about our vision. In fact, from the very beginning, Humanitas has always tried to integrate these three areas. So the clinical activities of our hospital, the research activities that are carried out every day in our research labs, and education, the main focus of our university. The aim of this integration is to offer students the best education available in order to train the future doctors, nurses, and physiotherapists that will take care of our patients, giving them the best the world's best medical care. I show you now the path, the story that got us here. All right. I hope you enjoyed this video. Now let's focus on Humanitas University and so on our educational offer. As you can see, in Humanitas University, we offer 4 undergraduate courses that are Medicine and Surgery and MedTech School that are taught in English, and then Nursing and Physiotherapy that are taught in Italian. We also have some postgraduate courses and continuing education as well. The focus of today is on the undergraduate courses and in particular on the medicine and surgery one. So let's go into details of our medicine and surgery degree course. Here you can see the main features of our medical course. So it is a 6-year course entirely taught in English. We host 130 European students and 50 non-European students per year. The environment of our course is a real international environment, since professors and students of the course come from all parts of the world. And it is also characterized from a full integration between theory and practice. Sometimes students ask me if the environment is international, and it is effectively international. I think that this picture shows you is a good answer to this question, because it shows you how where our students come from. And actually, we can say that almost all the countries are well represented in our university. For what concerns the integration, the full integration of theory and practice, we can say that students learn through 3 different learning environments that are the wards, where students carry out their traineeship under the supervision of medical teachers, the clinical cases, where students, together with teachers, study a real clinical case in order to get into practice what they have already learned in class. And the simulation center, where students learn specific maneuver with trainers and simulated patients. There's also a 4th learning environment, we can say, that is our research lab. In fact, Humanitas University offers every year a project where students can carry out some of their curricular hour in the research labs. Let's talk about the student experience. Here you can see all the main services that Humanitas University offers to all students. As it is happening today, we have the orientation office that offer all the orientation activities as the one we are doing today. For what concerns the main services that you can find inside our campus, we have a library, which is open basically all year long. We also have a canteen where students can have their meals at a fixed price. 2 years ago, we opened our student house, which is really close to the campus, and it can accommodate about 200 students per year. If you need any further information about the accommodation and the student house, You can go on our website, and I suggest you to fill in the form that you can find on the Student House page. In this way, your requests will be directly forwarded to the relevant team that handles all the requests about the accommodation. We also have an IT team that provides the students all the IT services, such as the so-called campus ID, which are the personal credentials that students can use to access, for example, the campus Wi-Fi, or also the computers of the library. And then we also have a language lab that offers every year some language courses, such as the Spanish course or the German course. We also offer support to our students from a psychological point of view with the counseling service, but also we offer support to students that have special educational learning needs with our DSA service. What about the international projects? Well, Humanitas University is already in the Erasmus project, but we also offer travel grants. And what are travel grants? Basically, students sometimes find their internship in hospitals and research centers during the summer, wherever in the world. For this reason, Humanitas publishes every year a call to application where students need to write down their project and where they have been accepted abroad. And the university will allow you to go for this experience, partially or totally covering the total costs of the experience. And then we also have a USMLE preparation course that is a course that helps students to take the USMLE examination, which is the exam that students need to pass in order to start their residency in USA. Let's talk about the admission test now. For the moment, the registration are not available yet, but they will be soon, probably in 2 weeks. For all the students that have their residence in Italy, the test will be on the 12th and 13th of February, and it will take place in the 15 test centers that we have all over Italy. Of course, the test will take place in our test centers only if in accordance with the next government's instructions. For this reason, Humanitas University will confirm or not that the test will take place in our test centers within 1 month before the day of the test. For all other students that have their residence in another country, the test will be on the 11th of February, and it will be online. Of course, for the Italian students, if the test won't be in our test centers, it will take place online as well. The test is made up of 60 multiple choice questions divided in scientific thinking and academic literacy. And you will have 120 minutes to answer to all these questions. But we will see the questions of the test in details with Professor Riccardo Sarti after. How can you prepare for the test? Well, first of all, you can study on books, and these are some suggestions and some books that you can use to prepare for the test. So if you want, you can write down some notes about these books, which are the UK CAT practice questions, especially the verbal reasoning, decision-making, and quantitative reasoning parts. You can also use the BMAT practice questions, especially the aptitude and skills and the scientific knowledge and application parts. And then also the IMAT test, especially the logical reasoning and scientific knowledge parts. For what concerns the academic literacy and critical thinking part of the test, we highly recommend you to read popular scientific articles. There's also another thing you can do in order to prepare for the test. That is to say, you can attend Humanitas University Preparation Week, which is an intensive course of 1 week that will take place in January, the last 2 weeks in January, for the 2021 admission test. And it will take place on our Demio online platform. The course will be taught entirely in English, and the aim of this course is to give you a methodological approach to the test, such as how to read the questions, how to immediately understand which are the wrong answers, and so on. So if you are interested in attending this course, you can check on our website, and probably the registrations will be opened in 2 weeks, more or less. Let's move on academic fees and scholarships. For European students, as you can see, the fees range from a minimum amount of 10,000 euros to a maximum amount of 20,000 euros on the basis of the ISEP index, which is basically the family income category. For non-European students, the fees are fixed, and it is 20,000 euros. We also offer some scholarships to students. In particular, we offer 7 scholarships for European students and 4 scholarships for non-European students. Some of these scholarships are full and some partial. That is to say, that will cover totally or partially the total amount of the tuition fees. How can you apply for these scholarships? Well, for the moment, you have to wait the admission test. In fact, one of the requirements to receive the scholarship is for European students to rank in the top 30 positions of the test, and for the non-European students to rank in the top 10 position of the test. All right, my presentation now is over. If you have any further questions, you can write me in the chat, or you can also use this email address. So recruiting@unimed.eu. Okay. And now I give way to Professor Maria Rescigno, who is the Vice Rector and Delegate for Research here at Humanitas. And I thank you again for joining, and I hope you'll have a great day. Thank you.
So, good morning, everybody. Thank you very much for the presentation. And how many people do we have, more or less? 80. Okay.
Yes, 80.
Okay. So today I will talk to you more about the COVID situation. So it's going to give you an example of how you can combine research with medical activities. So let me just share the screen. If you go in the chat, you can go to this site, which is called www.socrative.com. I put it in the chat. If you go on the link, you get into Socrative. Okay, so once you are in Socrative, then you choose login. Then you go for for students login, and you choose this room, SGM Corso. You can find it on the chat. Okay, so once you are in the SGM Corso, then you put your name. So first of all, you put your name, then you go into SGM Corso, and you start taking the quiz. Okay, I've seen that many people are joining.
Sorry, Professor.
Yes.
Some students ask if you can repeat the way to access Socrative.
Okay, so you go into www.socrative.com. You can find the link in the chat. Once you are there, you go into login, students login, and you put your name, and then you choose the room that you can find again in the chat, which is called SGM Corso. You can find it in the chat. But I've seen that most of the people join. So if you go into www.socrative.com, you go into login on the right corner, then you take the students login, then you write your name in it, and you choose as a room SGM Corso. I've seen that some of you have already finished. I mean, if you don't know the answers, don't worry, because you will repeat the same test at the end of our conversation, let's say, and so we will see how much you have learned and if now things are clearer, because I've seen that some of you have already answered correctly most of the questions. Some others have not, but don't worry. I mean, it's not something that I don't want to test you. I just want to see what is the difference between the beginning and the end. This is a clear example of what are the classes, most of the classes that are taken at our university. So you do a test before and then you do a test afterwards. And this allows us also to understand how much you could follow and how much of the class has got into you. Okay, you have a few more minutes and then I will close. I hope most of you have managed to enter. Give you 1 more minute, then I have to close. Okay, I'm going to close it. 10 more seconds. 5 more seconds. Okay, I closed it. Okay. So then let's move to the presentation. Okay, so you know that the SARS-CoV-2 is a virus. This virus is an RNA virus, so it has as nucleic acid is not the DNA as all of us have as a matter of transmission of our genetic code and material, but they have the RNA. And then they have these proteins on the outside, which is called the spike protein. So anytime you hear about antibodies to the spike protein, you understand which is the protein that is the target of the antibody. Then you have the nucleocapsid protein, which is covering the RNA, and this is also another target for antibodies. If you see at how much it has diffused, you know that there are countries that have had quite a high number of cases, including the US, India and Brazil are at the top, but you can see that also in Europe we have quite a high number, especially in Russia, France, and this is the situation in Italy. These are the number of deaths, and these are the people that have recovered from the disease. You can see that the lethality is quite low in the end, because considering the whole global situation is more or less 2.5%. And this is the reason, actually, why this virus has spread so much, because since the lethality is so low, there are many individuals that can recover, but they can also transmit the virus to other people, and so they become very contagious. And this is why it has spread so much, besides the globality of the world and the people moving from one place to the other. You can see here that most of the people that have been hospitalized, so now we are talking about hospitalization because of the presence of the SARS-CoV-2 and the COVID-19 disease. You can see that in both waves, now we are analyzing the world as a whole. Most of the people that have been hospitalized are people that are older than 65 years. But also people that are between 50 and 64 also have been hospitalized, quite a high number, 15% of the population. And you can see that while in the first wave, most of the people were in the higher age range, you can see that in the second wave, the middle-aged people have had more or less the same amount, while the older than 65 is reduced, partly also because these people have been vulnerable, they have been protected more in the second wave. But you can also see that individuals aged between 18 and 49 years old, they are increasing in the second wave, while mostly students between 5 and 17, they almost never were hospitalized, very few cases of hospitalization. This doesn't mean that these individuals are not infected, because they are also infected, primarily those that are 14 years old onwards. So what is the major proposed routes of SARS-CoV-2 transmission? It is via contact or droplets. Droplets means these small water molecules that are filled with the virus, that are released while we are speaking, or if we are coughing, or if we are sneezing. So this is the easiest way of transmission. And for this reason, wearing a mask is vital, because then you can stop the release of these droplets, and then also the possibility of transmitting the virus to your neighbors. And the distance that is the most associated to the transmission of the virus is 1 meter. So the smaller than 1 meter, the higher the possibility of transmitting the virus. Then you can see that another possibility is the capacity of the virus to remain on surfaces and to survive on surfaces. And this is dependent on the type of surface. So this is the aerosol, so how long the virus remains in the air, not with the droplets, but just in the air. And you can see that it's pretty quick, the decay. So in 3 hours, you can start seeing that most of the virus is reducing within the air. But if the virus attaches to a surface, if the surface is of copper, you can see that the survival of the virus is much lower than if it is cardboard or stainless steel or plastic. So on plastic, the virus survives much longer, even 60 hours, even up to 60 hours. But another important thing is that the virus is quite sensitive to sunlight. So if you expose the virus to sunlight, mid or high intensity, you can see that it takes a few minutes for the virus to be eliminated, to be inactivated. And this is important because it tells us why we had this period during summertime in which we didn't have the second wave, particularly in Italy, and this is most likely due to the sunlight. So which are the persons that are transmitting the virus most? So these are obviously the symptomatics in the first 5 days within symptoms onset. But the most worrying people are the pre-symptomatics, because in pre-symptomatics, we don't know that that guy is infected, and it's in the few days before symptoms start that the virus is highly transmitted. And 44% of transmission have been estimated to have occurred just before symptoms appeared, so 1 or 2 days before symptoms appeared. The truly asymptomatic, this means people that will not develop symptoms. So pre-symptomatics means just before 1 or 2 days before symptoms onset, but asymptomatics means those that after being tested positive, they will never develop symptoms. And these people are in the range of 6 to 41% of the whole population, so they are quite frequent within the population. But the transmission via the truly asymptomatics is pretty low, so it goes from 0% to 2.2%, while the symptomatic transmission is between 0.8 and 15.4%. So this is telling us that it is primarily the pre-symptomatics that are the ones that are transmitting the virus. but still also the truly asymptomatic can transmit the virus, because you can have those super spreaders that are still capable of transmitting the virus. This is an example that I picked this case because it's pretty interesting. This is an outbreak in lay bodies worshipping. So these people in China, they moved in 2 different buses. So the first bus had no cases, so there were no people that were infected. While in the second bus, there were 23 people that were infected. And you can see here that these are the cases. So in red are the moderate cases. There were the asymptomatic cases, which are very few. And then you have also the mild cases. And it's interesting that while in bus number 2, the attack rate was 34.3%, in bus number 1, there were no cases, and so there was no transmission that was related to the bus. But there were only 7 cases that were symptomatic after being infected in the temple. But the temple was one of those Chinese temples, so it was an open temple, so it was like being outdoor, and this is the reason why the transmission was so low as compared to the transmission within the bus. This is another example of transmission indoor. In a place that was overcrowded and not highly ventilated. And you can see here that this was the patient 0, so the one that transmitted the virus. And during that dinner, it was capable of transmitting the virus to 10 people that were close, either on the same table, but also in neighboring tables. And up to 4.5 meters of distance, still you had the viral transmission. And this is because it was overcrowded, but also not ventilated. And so none of the waiters that was infected, or the remaining 15 tables that were not so close to the patient 0. And it's interesting because none of the waiters was infected, and this is because the waiters were actually wearing the masks. And you can see here that the capacity, the risk of infection drops the higher the distance and the lower the risk of infection. So this is how they managed to say that 1 meter is the minimum distance that is reducing the risk of infection, primarily if you're wearing the masks. And in fact, if you analyze the masks, you can see that in one case, they analyzed the virus was detected in the respiratory droplets of 3 of 10 samples collected without face masks, while there were 0 of 11 samples with a mask. So this is definitely telling us that the mask is shielding the droplets and is not allowing the transmission of the virus. And so these are the risks associated to no masks wearing, 90% of transmission, 30% if one of the 2 is wearing the masks, and the other one, which is the infected individual, is not wearing the mask. 5% is if the infected individual is wearing the mask. So that would be still quite powerful. But if both of the individuals, so the one that is infected and the one that is not infected, are wearing the masks, is 1.5% of risks if there is less than 1 meter. If it is more than 1 meter, then you can see that if both of them are wearing the masks, the risks become 0%. So this is why both of the people have to wear the mask. And as I told you, since most of the people that are infectious are the ones that are in the pre-symptomatic phase, this is telling us that you have to wear the mask also if you don't have any symptoms, because you might be in the pre-symptomatic phase. So the more you wear the masks, and the lower is the risk of transmitting the virus. And this is a dynamic prediction of how much of what is the capacity of inhibiting the transmission of the virus. If you have two different R0s are, you have already heard every day practically what is the R0 is the capacity of infecting. So you have an R0 of 1, it means that one person can infect one. If you have 2, is one person can infect 2 people. And you can see here that if the population is wearing the face masks, this is the percentage. The higher the percentage and the more effectiveness of the mask. So if you take, for instance, the FFP2 mask, which is completely blocking the transmission of the virus, you can see that if 100% of the people were wearing the masks, then with this effectiveness at all times, so not just after symptoms arise, so even asymptomatic individuals, then you can completely reduce the R0 to 0. So you can block the capacity of transmitting the virus. Okay, so what are the recommended prevention strategies? So first of all, you have to identify and test suspected cases. So the more you test also individuals that are not suspect cases, the higher is the chance that you can isolate positive individuals, and so you can quarantine them. Then you can wash hands often with soap and water, because as I told you, especially if there is if you have a surface which is a plastic surface, then the virus can last for quite many hours, and so it's very important to wash your hands often, to maintain social distance, because I told you that even if you're wearing the masks, if the masks are not 100% protecting, so if you're not wearing the FFP2, but if you're wearing the surgical masks, then you have to still keep social distance, because you still have 1.5% of risk of transmitting the virus. Then you have to practice respiratory etiquette. So this means that you have to ventilate the room and aerate the room and disinfect these surfaces regularly. For instance, if you are in a library and if you're using a common computer, then the computer might have the virus on the keyboard, so you have to be careful with that. I mean, it doesn't mean that you have to always continuously disinfect your hands, but it is important that you don't put your hands on the eyes or in the mouth, because then you are transmitting the virus, because the virus doesn't transmit across skin surfaces, but it transmits across mucosal surfaces, so which is the mucosal of the eye and of the mouth. This is just an important thing to consider, that since patients, once their disease is worsened, then they have to go into the ICU, so you have to keep the amount of people low in order to allow them to, if they need ICU, to have enough ICU beds. And so these are the different types of intervention in 3 different countries. So in Australia, in South Africa, and Uganda. And you can see in blue line, if you don't do any intervention, you can see that without any intervention, with the amount of people and the capacity of spreading the virus, you can see that you will soon lose the ability of curing all these people. This is a logarithmic scale, so you can see that many people will and there will not be enough ICU beds for all of these people. If you do cycles of mitigation and relaxation, so mitigation means that you are using social distancing, hygiene rules, case-based isolation, shielding of vulnerable groups, and school closures, and so on and so forth. You can see that you can already reduce the amount of beds needed. But then if you do also the lockdown, as it is the situation here in Italy now, you can reduce the number of individuals that will be needing ICU beds. And then you are doing this primarily to allow the national health system to cope with infection, because this infection is so quick and so fast that you will have so many people needing hospitalization at the same time, that you have to somehow reduce the amount of contagiousness in order to allow everybody to be receiving the correct therapy at the right time. So this is the situation in New Zealand. New Zealand managed to eliminate COVID-19. What were the measures that they took is they did very quickly a lockdown. So February 26, they already had the first case. And on March 26, so one month later, they declared an alert level 4. And so they decided to lock down completely the country. And by June 8, they went into alert level 1. And then since this is also, they were lucky enough to be an island, so they could control whoever was entering the country, and whoever was entering the country was put in quarantine for 14 days. And this allowed them to completely block the spreading of the virus. They had only 1,569 cases and only 22 deaths. It is also true that the density, the crowding of this population is so low that there was no problem in reducing also the exposure of the people to the virus. The herd immunity concept allows to protect people even if they are not being vaccinated or they are not become immune. Let's consider an R0 of 4. So one person can infect 4 individuals. Then each one of them will be infecting another 4 individuals. You can understand why quickly then you are transmitting the virus with such a high R0. But if let's say that you are in the second wave, and in the first wave 3 out of 4 had already been infected, so you have 75% of coverage of immunity, you can see that one individual can infect only 1 person out of 4 of these that had been already immunized, either because they had been exposed to the virus or because they had received vaccination. And so you can see that you are reducing the contagiousness of the virus, and you are protecting somehow also some of the people that are has not been immunized for some reasons. So you heard that in Sweden they never did a lockdown, and so this was their situation. They were hoping to reach herd immunity, but that's clear that they didn't reach herd immunity. They still have low numbers of deaths, and we'll see what happens later on over time. But it is clear that, as I told you before, if you don't do any lockdown or containment of the virus, then if you reach saturation of the ICU beds, then you are in trouble, and then this is how deaths are increasing over time. The capacity of reaching herd immunity depends on the R0 number. So, for instance, measles, that is quite contagious virus. You need to have more than almost 100% of immunity in order to avoid spreading of the virus, because the R0 is so high that you have to increase the number of people that are vaccinated against the measles in order to avoid transmission and to protect people. And again, you can see here that Sweden reached only 6.47% of individuals, so it's far away, very far away from herd immunity. And so this is the reason why in the second wave they were much more hit than in other places. So screening and diagnosis. You can screen for the presence of the virus in different biological fluids and places. So you heard every day about nasal swabs, and the virus is highly present in the nasal swab, but it's also present in the throat. So you can do a throat swab, or the sputum. The sputum means the saliva that comes from within the throat. So you really have to expectorate in order to see to have the sputum, but you can also see it in the saliva, and this is the reason why many people are trying to push towards saliva as a fluid to test the presence of the virus, because it's almost impossible on the nasal swab, and it's easier to get a saliva sample rather than a swab. So this is how the infection starts. So you first have the pre-symptomatic phase in which the virus starts being present, and you can test the presence of the virus via a molecular test, so a PCR or an antigenic test. So PCR allows you to evaluate the presence of the viral RNA, and so not of the particles, but the viral RNA, while the antigenic test allows you to test the presence of the virus particles because it's going directly on a protein, while the PCR is on the RNA, so on the nucleic acids. And you can see here that so you have an increase of viral load. You can still test the virus via RNA also for quite many weeks after being infected. And even when the symptoms are released, so when the symptoms go down, you can still find in some cases the presence of the viral RNA, but you don't find the infectious virus more or less 10 days after symptoms onset. So you can think that after 10 days, that individual most likely is not infectious anymore. In some cases, you can still find the virus in the stools, so it's still not the virus, but viral RNA within the stools. And then when you start seeing that the symptoms go down, then you start seeing the presence of the antibody. The antibody, because the antibody is now neutralizing the virus, and so it's blocking the virus from being still infectious, and then the symptoms start reducing. The antibody response can start in normal infectious disease. The antibody response that is first is the IgM response. So this is the primary response to an infectious, and then you have IgGs. This virus is quite particular because it's completely different from other viral infections. And in fact, you can see here that the IgM response is almost coming at the same time as the IgG response. IgM response is a less affinity response, so it's has less capacity to neutralize the virus, but it's not really clear why the IgG response comes at the same time as the IgM response. So this is the reason why the tests are now mostly directly to the IgG rather than the IgM response. And the IgG seropositivity is interesting because if you analyze the patients that are symptomatic, so in red, you can see that also after in the convalescence phase, you can still find a lot of IgG seropositivity. So the IgG stay much longer than in the asymptomatic phase. So if you look at people that are in the initial infection state, you can see that most of the asymptomatic also develop antibodies. But then if you are asymptomatic, that the antibodies are reduced more quickly than in the symptomatic phase. But this doesn't mean that you might not have protection because you can still have what is called immunological memory. So you can still have a memory of the fact that you have been exposed to the virus. So this is what we did in our hospitals. So as you know, Humanitas is not just one hospital; it has several hospitals in all around Italy, and we did the analysis particularly in Lombardy because in the first wave, Lombardy was highly affected by the presence of the virus, and particularly one region that was the Bergamo area. You can see in blue are the infected individuals. So we analyze the IgG response, and this allows you to see also how many people have been infected. And even though they are not infected any longer, they still keep IgGs, as I told you. And you can see here that more or less 35 and 43% of the people in Bergamo were infected. And this is also the reason why the Bergamo area now is less affected, because they almost reached herd immunity. So they almost had most of the people nearly 40% of the people that were had been initiating an immune response, so IgG response. While if you look at the Milan area, this is Humanitas, you can see that 9% of the individuals of all the employees were positive for the antibodies. So this means that 9% of the people had been infected with the virus. While if you consider the Varese area, in where the viral diffusion was much lower than in other areas in Lombardy region, you can see that it was only 3%. And if you look at the symptoms of all of the individuals that were IgG positive, so the people also filled the questionnaire in which they were saying if they had symptoms, what kind of symptoms, and so on and so forth. And you can see this is the number of individuals, or the percentage of individuals among the all positive individuals. And you can see that 10% of these individuals were completely asymptomatic. So 10% of the people that were antibody positive, so they had been exposed to the virus, they didn't realize that they had been exposed to the virus. So these were truly asymptomatic. And then there were another 20% of people that had just 1 or 2 symptoms, which could be just a cough or a fever. So nothing that would tell them exactly that they had been SARS-CoV-2 infected or COVID-19 positive. If you analyze the amount of IgG, so how many IgG you have in your blood, and you compare this with the number of symptoms, you can see that the more the symptoms, the higher the level of antibodies. So if you have more symptoms, this means that you probably had a higher viral load, so more virus within your body, and so this is why you had more IgG responses. And among the different symptoms, the one that were characteristics of COVID were fever and loss of taste or smell. And if you had both fever and loss of smell or taste, even if you didn't do the antibody test, you would know that you had been exposed to the virus, because almost 95% of the people that had these 2 symptoms, they had been they were IgG positive, so they had been exposed to the virus. So why are antibodies so important in viral infection? So they are important because if they are neutralizing, so if they bind to proteins on the cell surface of on the surface of the virus, which is fundamental for attaching to the receptors on the cells. If the virus is binding to the receptor, then it's internalized, so it's infecting. If you do have antibodies that bind to the proteins that bind to the receptor, then you also block the capacity of the virus of infecting. This is called neutralization. So if you have antibodies that are on the surface of the virus and block the proteins to interact with the receptor and to get internalized, then you are also neutralizing the virus and you're blocking their infectious capacity. And you can see that it depends on the patients. These are different patients. This is over days, and you can see that in many cases you do have the induction of neutralizing antibodies if you had symptoms. But this is not that clear if you didn't have symptoms. If you are in the asymptomatic phase, if you do have antibodies that are directed, that are neutralizing the virus. So what is the natural history and the clinical presentation and symptom spectrum? So as I told you, you can have several symptoms. You can go up to 14 different symptoms of the viral infection. The ones that are more characteristic of the viral infection are loss of taste or smell, but also cough and fever, as I told you. But then you can have fatigue, muscle pain, body aches. You can have nausea, vomiting, diarrhea, so all gastrointestinal manifestations. But besides these, the type of symptoms that people experience are dependent also on the age of the patients. So if you take young patients, they mostly have ear, nose, or throat complaints. while elderly patients, they experience fever, fatigue, loss of appetite, diarrhea. And there are also some symptoms that are associated more to women rather than men. So, for instance, headache and loss of smell and nasal obstruction are mostly characteristic of women, while cough and fever of men. And this is the percentage of symptoms over the different patients. But you may also have some extrapulmonary manifestations of COVID-19, which can be dermatologic. There are people that have vesicles or urticaria. You can have cardiac associated symptomatology, so cardiomyopathy and cardiogenic shock. You can have also neurologic, as I said, a headache and so on and so forth. Thromboembolism is one of the characteristics of severe disease, and this is one of the reasons why people can receive heparin as an anticoagulant. But then you can have gastrointestinal, renal, and so on and so forth. So these interestingly enough, you can have some symptoms that persist also quite many months after being clinically considered as recovered. So fatigue, for instance, has been shown to be in 60% of the patients in the follow-up, and the follow-up was in a mean of 60 days after disease. So dyspnea is also another one that is quite common in the follow-up. But these are primarily related to older patients. In concomitant with the virus, you can also have some bacterial or fungal co-infections, which is quite common in COVID-19, less common so than in influenza virus. So what are the risk factors for critical illness? Is primarily the age. So individuals older than 80 years old, they had higher chances of case fatality rate. You can see here 14.8%. Then you have cardiovascular diseases, 10.5%. Age between 70 and 79 years old, 8%, diabetes 7.3%, or chronic respiratory diseases, hypertension, and finally cancer. So you have these comorbidities, you have higher chances of case fatality, of increased case fatality rates. So what are the drugs that are used for treating COVID-19? So there are some antivirals. You can see here that convalescent plasma, so the plasma from super immune individuals, is considered as an antiviral because as it is full of antibodies, if these antibodies are neutralizing antibodies, then you can block the viral infection. So this is why this is considered as an antiviral, but also you can use immunomodulators like corticosteroids, for instance, dexamethasone, cortisone, and this is also pretty used because the COVID-19 is characterized by two phases. The first one is the viral response phase. So in the first part, you have the virus, which is infectious, and so you can and this is the early infection phase, and you can use antivirals here. There is remdesivir, that is one of those antiviral drugs that are quite useful in the initial phases of infection. But then once the virus has infected and has initiated a host-inflammatory response, is this inflammatory response that is responsible for the hyperactivation of the immune system and for the fatalities, because it is the high inflammatory response which is responsible for the fatalities. So if you want to use an antiviral drug, you have to go to do it very early in the initial phases of infection, but then you have to switch to a cortisone or an anti-inflammatory drug because then you need to stop the inflammatory response. You cannot start too early with the anti-inflammatory drug because you need the immune system to be efficient in initial phases. So it's very important when you start treating with corticosterone and dexamethasone. And it has been, the new guidelines is that when you start needing oxygen, then you should also start with the dexamethasone. There are several vaccines in the development pathway. So they started with 91 possible vaccine candidates. 28 are in phase 1. Phase 1 is just a toxicology safety phase. So you want to make sure that the vaccine is safe, and you do it on quite a small number of individuals. Then you do a phase 2, that is an initial phase of testing the efficacy of the vaccine, so how much is capable of inducing an immune response, an IgG response, which is neutralizing response. And then in the phase 3, you consolidate this efficacy capacity of the vaccine to induce an immune response, and then you have the approval. So the approval, there are 5 now that are under the approval. Let's see what happens and when these are become available for the population. And then these are the different types of virus of vaccines that have been proposed. So you can have the coronavirus that is inactivated. So you can take the virus, you inactivate the virus, so it's not capable of infecting and proliferating anymore, and so you use the virus inactivated. There are several vaccines that are of this type. Then you can have a viral vector, so in which you take one of the proteins of the virus, for instance, the spike that I told you in the beginning, the gene for the spike, and you can put it into another viral vector which is inactive, and so you then this viral vector will be infecting the cells. It's not an infectious virus, so it's just allowing the protein to be produced, so the spike protein, and then you have the spike protein which is produced, and then you can have the immune response to that protein, or you can use other type of measures that is either via RNA, for instance. One of the vaccine is based on mRNA. Or another possibility is to use the convalescent plasma, so the superimmune plasma. So you take a patient that has recovered from COVID-19. So if he has recovered, this means that most likely has antibody that are neutralizing antibodies. So you take the blood from this patient, you collect the blood, and then you reinfuse the blood into another patient, and you do this in the early phases because, as I told you, you want to block the viral replication and infection, and so you have to do it only in the early phases of infection. Otherwise, there is no use to do that. And similarly to this, you can use the monoclonal antibodies, so they have collected the blood and the cells from individuals, and they have been isolating the antibody, analyze whether the antibody is effective, and then use this antibody for the patients. There are at least 3 clinical trials that are ongoing on this. So I'm finished, and I thank you all. Now you can take again the questionnaire. So you go back to the www Socrative, and you can go back into the room SGM Corso, and let's see how it goes, and then we see the results from that. Let me just okay. Okay, I hope you remember how to do that. You go in www.socrative.com, and you log in again, and you take the test again.
Professor, there's a question in the chat for you. If you, I can read it, or
no, I can read it.
Okay.
No question. What is the difference between R0 and the so-called here in Italy RT? So yeah, the difference between R0 and RT is that so R0 is if you analyze for is the average of numbers of people that are infected for a population. RT is for one particular person. So if you can follow up the patient 0, you can analyze the RT for that particular patient. So R0 is across the population, RT for one particular person. Okay, let me see how is it going. Most of you have finished. I hope, I mean, I've seen you have, let's say 10 more seconds to finish. I've seen that most of the people have finished. I'm really very, very happy. It went so well. You were very good. We're really good. I mean, as compared to the first test, the second went almost perfectly. There are questions here. There is one question, the first question, which has 97% of right responses. Right answer. One is the second is 95%. Now we'll see the responses. Okay, so I have to finish it. Okay. Now I will share again the screen and we see the results all together. Okay. Okay, so you can see here that in most of the cases you had I'm not putting the names of the people, of course, but you can see that there were most of the people that answered correctly most of the questions, and we can go back to the questions if you wish. Okay, results. Why am I not seeing the results? Sorry. Okay, so this was the last one, and we can see the initial one, which is this one. Okay, so you can see the difference, right? So this was before, okay, and this is after. You can see the difference. So if you want, we can go through the answers, but I think you have done most of it. I would rather ask whether you have questions, or if you want to have some explanations on the quiz. Do you have any questions? Or maybe I can ask you some questions and you can answer in your chat. So the question I want to ask you is, I mean, we know that individuals between the age of 20 and 30 are the most asymptomatic ones. So how would you try to stop infectious? Which are the people that you would monitor most among the possible contagious people? You can answer the question in the chat if you wish. which is the category of people that should be most. After 10 days of testing positive, does the individual can still infect other persons? Well, this is a question that you posed. Yes. So the question is if after 10 days, yes, after 10 days, if you had symptoms, and after 10 days, you should be no longer infectious. And this is also the reason why after 14 days they take the second swab, and normally they do it after another week. But after 14 days, if even if your test is still positive, since you are testing only the RNA. And I told you in the beginning that the viral RNA can stay also for long, but the particles after 10 days are not found infectious particles, so you can consider that person as not infectious anymore. The WHO has taken this as an indication. So after 10 days, you shouldn't be infectious any longer. So, but you didn't answer my question. So which is the population that you would carefully monitor for being infectious? Because we know that if you are symptomatic, that's easy. You are infectious. So which is the population that that is more infectious? I told you during my presentation is the pre-symptomatic people, right? And also the symptomatic, right? Is the president, if I'm not mistaken? Yes, I would monitor the group of 18-30. Yes, very good, Alessio. That's exactly the youngest, the pre-symptomatic and the asymptomatic between 18 and 30, because these are the ones that are more infectious. Because even though the truly asymptomatic are little infectious, they still at 2.2% of these are infectious. And if you consider how many of them are asymptomatic, it seems like in a population, in a group in which the virus has spread quite highly, 40% of the people become asymptomatic, or they have one or two symptoms. I showed you what happened in our case in our in Lombardy area among our hospitals, that around 30% of the people had just one symptom or two symptoms. And so these people, if you consider that 2.2% of these are contagious, then you can understand that you still have quite a high population that is transferring the virus without even knowing that they have transferred the virus. Okay, guys, I think I'm finished. I thank you all. I hope you have learned a lot, and from the test it looks like, and maybe some of you will be joining Humanitas University in the next years. And I wish you all good luck.
Thank you so much, Professor.
Okay. Bye-bye, Elisa.
Bye. Thank you
Have
again.
a nice continuation. Thank you, guys. Thank you very much. Bye-bye.
Okay, now we can continue with Professor Riccardo Sarti, who he is a lecturer of biochemistry here in Humanitas University. And I give him the way.
Hi, everyone. Hi, Lisa.
Hi.
Thanks for the introduction. Yeah, just to clarify, I am a teacher of chemistry and biochemistry for the nursing and physiotherapy students, but I also teach logical reasoning and maths during the preparation weeks. So that's why I'm here today to explain to you how the HUMAT test is built. So let me maybe share my screen. Okay, so today together we are going through the structure of the HUMAT test, and then you will be doing a very little simulation of both parts of the HUMAT test. And in the end, I hope we have time to correct the part that, let's say, is closer to what I can do, so the scientific part. So let's start from the structure of the HUMAT test. There are two big parts. One is called the scientific thinking, and the other part is called academic literacy. Each part contains 30 questions to be answered in 1 hour each. And the two sections are completely separate from each other. So first you will face the scientific thinking in the live test. And once you have completed that part, you will move on to the second part. And it doesn't matter if you finish the scientific thinking earlier, you cannot use the spare time from the first part for the second part. So they are really separate from each other. All the questions in both parts are multiple choice questions with these characteristics. Each question has 4 options. Only one option is correct. The other 3 options are incorrect. You earn 3 points for each correct answer. You lose 1 point for each incorrect answer. You get no points if you leave a question unanswered. So as a consequence from the score of the correct answers in each section, in each part of the HUMA test, so scientific thinking and academic literacy, the maximum score is 90 points. And the maximum total score, which is the sum of the 2 scores, will be at most 180 points. Now, the scientific thinking is further divided into 3 sections. One is called the mathematical thinking, the second one procedural thinking, and the third one visual thinking. So each question of the 30 questions belonging to the scientific thinking belongs to one of these sections. And actually it's 10 questions per section. So there will be 10 questions of mathematical thinking, 10 questions of procedural thinking, and 10 of visual thinking, which are presented in random order, with the options shuffled randomly. So each candidate will see a different order of the questions and a different order of the options in each question. The mathematical thinking is built on a set of abilities, which are the following. One is predict changes in variables in simple formulae. Another one is use formulae by substituting values and calculating the result. Another ability is solve problems with symbols, including simultaneous equations. Another ability is working with orders of magnitudes and conversions. Then put numbers in the correct order, including decimals and negative numbers. And finally, interpret graphs, given an example. So you can see that there are 6 abilities on which the 10 questions belonging to the mathematical thinking are built. So I think that for sure you will find at least 1 question per ability, and then additional questions, the 4 additional questions maybe correspond to some of these abilities which appear twice, or maybe some abilities that are across 2 abilities in this set. Then the procedural thinking questions are also built on a set of abilities. Choosing the most effective concept map to summarize the text. Apply the concept of collecting elements from different sets. Follow a procedure or a protocol or algorithm correctly, for example, using flowcharts. Compare a set of data with a scientific theory that can be confirmed or disproved by the data. Predict the outcome of a perturbation in an interconnected system. And finally, select relevant data. So again, there are 6 abilities, but 10 questions that are built on these. So for sure, I think you will find 1 question per ability, and then the 4 additional questions will double some of these abilities, or maybe will cover 2 of these abilities. Last but not least, the visual thinking. It's 1/3 of the scientific thinking, and it's built on its own set of abilities. Recognizing mirror images, demonstrating 3-dimensional thinking ability, demonstrate careful observations, including localizing objects in relation to other objects, identify different visual patterns, a picture or a set of elements, and then find complementary shapes. So each of these abilities, of course, refer to visual abilities. So each of these three sections contains abilities that come from a discussion, an investigation that has been done on the courses of the first 2 years in medicine. So people in humanities try to understand what abilities a candidate should have in order to succeed, in order to thrive during the first 2 years of medicine. So starting from the courses that you will have to attend during the first 2 years, people in humanities try to identify some key abilities, and these lists of abilities come from this investigation. The other part of the HUMA test, which is half of the test, is the academic literacy. This part contains 5 texts about scientific topics, and each text is followed by 6 questions. So a total of 30 questions. The texts are about 700 words and divided into 6 paragraphs usually. And generally, there will be 1 question per paragraph to, let's say, to help you out in the resolution of the exercise. So usually also the order of the questions per text will reflect the order of the paragraphs. So in that case, the order of the questions belonging to each text is not randomized, but the order of the texts will be randomized, as well the order of the options in each question. Anyway, once you have completed both parts, the scientific thinking and the academic literacy, in the end, you will have 2 big scores, 1 score of the ST and the other score regarding the AL. And the ST is actually composed of the 3 sub-scores: mathematical thinking, procedural thinking, and visual thinking. By the way, during the test, you will see a label on top of each item telling you if it belongs to the mathematical thinking, the procedural thinking, and the visual thinking. It's not really relevant because what matters most is the scores that you get in the big 2 parts, not really the sub-scores in the ST. But they will be used to distinguish candidates that have the very same 2 big scores. So let me explain how the ranking works. There is an important threshold to be aware of, which is the following. If you get a scientific thinking score which is less than 20, or an academic literacy score that is less than 20, you are not admitted in the ranking. So you may have a total score which is very high, but if one of the 2 scores is below 20, you're not admitted in the ranking. So be very careful, keep this in mind. You need to work well both on the ST and the AL, so both on the scientific part and the, let's say, the text comprehension, basically. So here is a striking example. If candidate A has got 19 in the scientific thinking and 20 in the academic literacy, while B has got 20 and 20 in both parts, well, candidate A has a score which is below the threshold, so candidate A is not admitted in the ranking, even though they have obtained 90 in the other part. So the total score is much higher than candidate B. But candidate B, on the other hand, is admitted in the ranking. Okay, so be very careful. Last year, this year, but in February, so during the last, at the end of the last live test, there were definitely many people who were excluded from the ranking based on this threshold. Maybe with very high scores in the ST or in the AL, but in the other part they scored a not high enough value, so they were excluded from the ranking. Once you are admitted in the ranking is built on the total score, which is the sum of the two scores ST and AL, which is the most natural choice. So nothing really difficult to explain about this. If candidate A has got 50 and 30 and B has got 40 and 35, both are admitted in the ranking because they both reach the thresholds, but A has got 80 and B has got 75, so A will be higher in the ranking than B. But it happens that some candidates have the same total score. In that case, the, let's say, more equilibrated one is higher in the ranking. This more equilibrated one means with closer scores of ST and AL, which in mathematical terms means a smaller absolute value of the difference between ST and AL. Let me clarify this with an example. So if candidate C has got 50 and 30 and D has got 45 and 35, they are both admitted in the ranking. Their total score is 80, so they would be at the same level, but candidate C has a higher absolute score difference than candidate D. So D has closer values than C, as you can see. So candidate D is, let's say, more equilibrated than candidate C. So D will be higher in the ranking. Okay, D will be higher in the ranking compared to C. And this rule was also used many times because many candidates had the same total score. So in order to distinguish them, this rule had to be applied at the end of the live February 2020 test. And then there are rules that explain how to distinguish candidates with almost the very same scores, so with the same total score and the same absolute score difference. In that case, the higher scientific thinking prevails. So the scientific thinking is seen as slightly more important than the academic literacy, but only in this case. And if I remember well, this rule wasn't even applied in the last live test because it wasn't necessary. Okay, this case is already very unlikely. But let me clarify this with an example. So the assumptions mean basically that the two candidates have either the very same total scores or swapped total scores. Sorry, the very same scores or swapped scores. So 50 and 30 and 30 and 50. So same sum, same difference, I mean same absolute score difference, but candidate A has a higher scientific thinking score. And that means that A will be higher in the ranking compared to B. But again, I repeat, this is a very unlikely case. There is also a rule concerning people having the very, very same scores in the ST and in the AL. In that case, we look at the subsections of the scientific thinking. And that's why you see the labels during the test of each item in the ST, because you need to know what kind of item you are facing, okay, so that you can apply some kind of strategy if you wish to. But this case didn't happen in the last live test. I think it's really unlikely for this to happen. So you basically can just ignore the information about the subsection of the scientific thinking that the item you are facing belongs to. Okay, but in any case, if we had to look at the subsections, the first subsection would be the procedural thinking, then the second one, the visual thinking, and last one, the mathematical thinking. So the procedural thinking is regarded as the most important one among these, followed by the visual thinking, and last, the mathematical thinking. Okay, so here are some examples, but I think it's quite unnecessary and useless to go through them. In any case, if Elisa sends you the presentation, you can go through them on your own. So I prepared some examples, but since we only have 1 hour together, I think it's more useful to directly do the simulation now. So let's do directly the scientific thinking simulation, otherwise we don't have time to discuss it together. So in principle, on your own screen, you will see these questions, but of course you need to look at the PDF file to see the complete question. We will correct this later, okay? So, but the answer in this case was 1/8 times m. So move on to the second question. What is the mistake in their moves? Okay, so unfortunately, Kahoot is forcing you to answer each question within 2 minutes, which is not as in the live test. Okay, in the live test, you will have 1 hour for the whole scientific thinking, and it's up to you to decide how to spend that time among the items. So you can even spend 5 minutes on one question if you wish. Okay, maybe it's not a clever thing to do, but if you wanted to, you would be able to do that, which is not the case here. So this is not really like in the live test. Okay, so I'm sorry about this, but it's a new tool for, I think, all of us. Third question, move on to the third question. Which statement is not correct from the point of view of B? Sorry, time is up. So the right answer was the yellow one. On the left-hand door, the circle to the left of the gray square is black. Fourth question. Move on to the fourth question. What is the lowest unit price sports feet as tested on the market? Okay, time is up. The lowest unit price was 4 euros. Let's move on to the next question. How many different outfits can John make with blue, green, and black? Okay, time is up. The right answer was 5. Okay, the last answer. Next. Last question, which is complementary to the sphere above? Okay, great. So here, in this case, most of you answer correctly. Answer C. Yeah, how difficult questions? Okay, so let's do this maybe. Only 8% was correct. How many different outfits can John make with blue, green, and black? Of course, during the preparation weeks, we will go through many more examples and the resolutions. So here the idea is that, first of all, we need to read the text very, very carefully, okay, to understand what's going on. What's the picture? What are the rules? So John is choosing his outfit, and this is what he has in his wardrobe. For shirts, 3 pairs of trousers, 3 ties. Some items of clothing are the same color, but they differ in style. And we know that John's outfits always consist of 1 shirt, 1 pair of trousers, and 1 tie. So we need to pick 1 item from each of these sets. Each item of clothing is always a different color. two outfits are considered different, that they differ in at least one item of clothing. So for example, if I choose one of the blue, let's say if I choose the red shirt, the blue pair of trousers, and the black ties, I can have two outfits because I can choose two different ties with the black ties, okay, because they're different style. Anyway, now we want to use the colors blue, green, and black. So maybe let's use abbreviations like L for blue, G for green, and K for black. So let's look at the items that we have. Okay, so the shirts can be blue and black for the colors that we are interested in. The trousers can be blue or green. The ties can be blue or black. Okay, so let's start from the trousers. Trousers could be blue or green. If the trousers are blue, let's continue this way. What about the shirt? Well, the shirt can be either blue or black with these colors, but we have already used blue for the trousers, so we can only choose the black shirt. Okay, so we only have one choice. And can we choose a tie? Well, the ties are either blue or black, right? So we have already used those two colors, so there could be no tie that we can choose in these under this hypothesis. So we cannot start from DL trousers, from the blue trousers, because we wouldn't have the other colors for the other two pieces of clothing. Okay, so we need to use the green trousers for sure. Then what about the shirt? Well, the shirt can be either blue or black. And for the blue shirts, there are two options. If we choose the blue shirts and the green trousers, then we can choose only the black ties. And there are two choices for the black ties. If we choose the black shirt, we need to use the blue tie. Only one choice. So one outfit is green trousers, black shirt, blue tie. Okay, one outfit is obtained by associating green trousers, black shirt, sorry, and no, black shirt and blue tie. The other outfits are 2 times 2, because each of these two blue shirts can pair with each of these two black ties. So 2 times 2, which are 4, are the other possible outfits, which are all with green trousers. Then, in the first one, we have blue shirt number 1, because there are 2 blue shirts. Okay, there are two blue shirts. So blue shirt number 1, blue shirt number 1, which will pair with the other black tie. And then, sorry, I'm making a mess here. What's the rubber? These are blue shirt number 1, blue shirt number 2, and then black, and then blue shirt number 2, blue shirt number 2, paired with the black tie number 1 black tie number 2, and black tie number 1, and black tie number 2. Okay, so each of the 2 blue shirts combines with each of the 2 black shirts. So that gives a total of 4 outfits, that combination of colors, and 1 outfit only for black shirt and blue tie. In both cases, they pair with the green trousers, and that's the most we can do. Okay, so there are 5 total outfits. So this is kind of a reasoning that you should do in order to solve these kind of problems. There are not really formula to be used. It's more a matter of organizing your thoughts, okay? Organizing the problem in a diagram to count systematically, in this case, how many possible combinations you have. Okay, so thank you everyone. I'm sorry I can't stay longer, but something else is following, I think. So good luck for everybody, to everybody, and for everything, for every choice you will make for your future.
Thank you so much, Riccardo.
Thank you, Elisa, for helping. Bye-bye.
Welcome. Bye.
Thank you. Everyone.
All right. I see that there are so many questions about the test, the scholarships. Well, guys, we will probably publish the professional day also on our channels, so you can see again all the information about the test, the admissions that we have already said. So don't worry. Now I would like to introduce you Dr. Fabio Carfagna.
Hi, everyone.
Hi. He will show you more about the simulation activities that we carry out in our simulation center. I give him the way.
Okay. Hello, I'm Fabio. I am biomedical engineering, and I manage the simulation center. The simulation center, which is composed by this room, we're here, and another 3 rooms that are actually a high fidelity room. I'm going to show them to you in the following minutes. We also have the anatomy lab. I was telling you about the simulation center. So the simulation activities are composed by technical skill training and non-technical skill training. I'm actually calling you from our skill lab, in which you can train for different techniques. So you are going to, train in doing something before doing it on a patient. So we are several mannequins, like this one, or there are different kind of device that you can try here. I'm going to show them to you in a bit. And, the simulation activities are really important. I mean, many people think of that as a game or as a fun way to learn. It is actually a fun way to learn, but it's really important to be prepared. You can be prepared not only by knowing something, but also by experimenting something. And I saw some question about cadaver dissection and the possibility to train inside the hospital. We do both of that. We have a tight collaboration with the hospital in Humanitas right here, and we have an anatomy lab in which you can, have your first experience while exploring the human anatomy. And so we don't use cadavers. We do use cadavers, but I mean, for ethical reasons, you will only use them when you are skilled enough to benefit from a learning experience from a an anatomic piece of a human body. So as I was saying, I'm going to show you some videos from our the first are only promotional videos, but I'm going to show you what the students are really doing. And this is more like showing you what is really a simulation, high fidelity simulation all about. So it's about managing the whole experience of a clinical case. So you are in high stress situation in which you need to manage, maybe some parents of the person, and you have to manage a critical condition. You have to understand what is going on, ask for exam, collaborate with your colleagues, and try to figure out what is wrong and how to perform a therapeutic plan. It's really, as I was saying, really important because most of the clinical error that happens inside the hospital are not actually due to not knowing the technical part of the doctor business, but actually it's more like not knowing how to work with the team and with the colleagues. So there is a miscommunication, there are problem in communicating with the patient, problem with the communication with the staff. So you have to really invest in growing as a person, not only from the technical point, but even from the professional point and personal. So those are two of our students that are actually doing something inside the simulation center. They are doing clinical cases presented by our teacher. They are alone inside the simulation room, and they need to, perform as if they were in the hospital. So you see that they are dressed as if they were in the hospital. They have all the devices that are actually used inside the hospital, and they need to communicate with the patient and understand what is going on. So this is a bit of a briefing, just to understand what is the problem about. Then they can start by communicating with the patient and understand why it's here. They are starting to perform some exam. And with this high fidelity mannequin, you can actually listen to their heart or their breathing pattern. So you can, discover what they have while actually performing the exam. They are checking the abdomen and the legs. And after that, they're trying to, get some information from the lab and planning for their next the next step. What we also do is a workshop with the hospital. So there was this particular time in I believe it was in April, in which we went to the ICU department and we streamed that to the all of our students just to get the feeling of what is going on inside the COVID area. And it was really interesting, I think, even for the student part, because they started to get a feeling of what's going on and what's happening and how the life in the hospital really is about. After that, we came here inside the simulation center to do a bit of a show and tell, and to how the real ICU professional treat a COVID patient. So there was a bit of a lesson there on how to manage a patient and how to intubate it. And they are dressed a bit funny just to keep things lively. But I mean, all the devices beside the glasses are real, and the students from home, they can follow the cases and ask a question. And this is an example of how we can still teach in a practical way while having to deal with this pandemic. And another thing that I can show you, this is from yesterday. We went to do some training inside the operating room. So this is one of our nurses that is actually explaining how to enter the operating theater. So this is a live training from inside the hospital, from hospital professional that is teaching you how to do something that you will need to do when you become a doctor. So I see there are some questions. When we get to go to the simulation lab? Well, simulation activities are not for the first year. You need to become a bit more, skilled in the theory before going to the practical part. I think the first simulation activity you have in the third year, I think, you're going to go to a pathway. So you are going to start with some technical skills. So like, drawing blood, then you can start again with the suturing part. And you can learn how to suture. Then again, you are going to go and take on more difficult challenges. So a clinical case, history taking, or how to deal with an emergency. But it's not only the activities that are interesting for us. There is also the different way of teaching. So we also have you know, as you can see here, a different way of teaching human anatomy. So you can see that there is a computer in which I can use to interact with this holographic device, and I can use it to teach anatomy for you know, the medical students or nurses, and you can you know, better grasp what is the 3D anatomical structure and how they you know, work with each other, and you know, it's a better way to learn something that from the book it's kind of difficult to get the feeling of the 3D anatomical structure. Back again. Another thing that we can do inside the simulation training is actually a postgraduate education. We follow all the residence, all the post-residence courses. So there are a lot of ugly specific educational pathway that after your residency you can still follow, and you know, goes on into your continual medical education. I don't know, I still have I think 10 minutes if you have any question, or well, I can also show you our simulation lab live. You can see here that we are already prepared for Monday. On Monday there is a master class for nurses, and they're going to, you know, perform a simulation for you know, the management of the operating room. This is one of our 3 simulation room, and it's using one of our mannequins, and you can see that I can see all the parameters that this particular patient has. I can control everything about him, so I can you know, change the course of the clinical cases however I want. I see a lot of message. If there are any questions, please forward that to me. And thank you all. I will see you, some of you, in the next year.
Thank you again, Fabio.
Bye.
Bye. So guys, I've seen that there are many questions. If you need any further information about the admissions, you can write to our email address. I write you the email in the chat. So thank you so much for joining again. And for all the other information, please write to the email address that I have you before. I hope you enjoyed the event, and I hope to see you soon, and maybe among our students. Thank you so much. Bye.